Thank you for joining. Power to Practice 2-Minute Tuesdays presents adding a new patient. Today, we will be reviewing how to add a new patient to improve your workflow. First, on the Power to Practice homepage, use the search tool to search for the patient using their last name, first name, or by date of birth to make sure they are not already in the system. Once you have confirmed the patient is not already in the system, click New Patient to start the process. Now, we can begin to review and fill in the required areas needed for a patient's chart creation. Enter in the patient's legal first and last name for accuracy in lab and prescription ordering as well as insurance reimbursement. The patient's email address and phone number are required. Enter in a dummy email like noemail@email.com if the patient does not have an email address. To note, the email address is very important to set up the patient's portal. You can select here if the patient would like to opt in to communication via email and phone. Select how the patient would like to receive their appointment reminders. If there is a referral, enter in the office name or practitioner here. Enter the assigned provider by first or last name and select from the auto-populated options. The assigned provider will auto-populate on the encounter form to determine pricing, and it dictates which provider will be notified of the patient's lab results in the event your practice does not have an assigned recipient for results. Select from the drop-down menu the patient's date of birth and gender. Next field offers a drop-down menu to select how the patient heard about us. You may add or select a preferred pharmacy for the patient. This is optional, but you may upload a photo of the patient. Include the patient's address. This is not required to add the patient to P2P. Select the patient's time zone so they receive reminders for scheduled appointments in the correct time zone. Include an emergency contact. This is not required to add the patient to P2P. Enter a username and password to create the patient's portal access. The username should be unique to the patient. The password can be something generic like "Welcome One." You do not need to share this information with the patient in order for them to access their portal. The patient will receive a welcome email to log in to their patient portal for the first time. Once all fields have been completed, click on Save to save the new patient's chart. Thank you for joining Power to Practice 2-Minute Tuesdays presentation of adding a new patient. Look out for more 2-Minute Tuesdays coming your way.